When a person experiences a traumatic event, it can change the way they see the world. Ironically, the public institutions and service systems intended to assist and support traumatized individuals are often themselves trauma-producing. The UP Center, a local nonprofit, was recently awarded a community impact grant to support the development of a trauma-informed care network. To explain what that means to us are Kelly Evans, the UP Center's Vice President of Community-Based Programs, and Erin Portnoy with the Child Abuse Center. She's Executive Director there, and that's with the Children's Hospital of the King's Daughters. And thank you both for coming on to explain what seems like a rather long name for something, and it may not mean a whole lot to the layperson, but it's such an important step toward helping people who have experienced trauma. And so trauma itself is a word that people might define differently.
Absolutely.
So how do we define trauma in this particular context?
Well, we define trauma as a behavioral emotional response to like a terrible event, such as something violent or abuse, neglect. It could be domestic violence, it could be community violence, it could be a one-time event or something chronic. So all of these things could cause symptoms in people, in children and adults alike.
And these symptoms can be behavioral, but they can also be physical. And that's one of the things I think that's changing the line of thinking here, that this is not something that may just be a one-time event.
Right, and it doesn't just affect the person, it affects their family, the environment around them, and then the community at large.
Right, and we see examples of this all the time just from watching television.
Right, right.
So that is just but one example, but some people have very, very personal things that they don't want to talk about and don't want to share. But then there's the other end of the spectrum of the people who might be out there to help. And that approach is what has been shifting.
Yes, it has been.
Yeah.
I think you mentioned the physical, how trauma manifests physically. I think we know from studies, the CDC and Kaiser Permanente did the big study back in the 90s, and they really showed that trauma impacts us physically. They did a study on the relationship between childhood abuse and kind of domestic unrest and leading cause of death, and they really found a connection, and they're continuing to study individuals in that group to really kind of bring forward the data. But we know that trauma affects you physically and mentally.
And many people know that, but having to applying that to practice is what has really been changing along the line now. And so the thinking is now gearing toward this being less of a, I'm going to treat you for this, and this person's going to treat you for that, and maybe we'll go over here and they will address this aspect of it. Instead, we're all going to look at this from not just even the individual's trauma, but just the big picture.
Right.
And the fact that it could be a lifelong type of thing that they are going to have to adapt and change to. The individual is, as well as the people that are around them in their lives.
Absolutely.
Right, and so what you're speaking of, it's like a systems approach, a systems change, and we're moving more towards the trauma-informed care to be able to, as a system, have a structured and organizational way to work throughout various agencies. So that's why the collaboration is so important. That's why the creation of the Hampton Roads Trauma-Informed Network was created, because we want to create the same language that all agencies are speaking, and be able to provide services to families and children, like families of all ages, and create a seamless community of services.
Okay, great. So that everybody understands things in the same way, they interpret them in a similar fashion,
Right.
and address them in a way that's going to benefit not just one provider and that client or patient at that particular point in time, but can be translated and interpreted by everybody in a similar way.
Absolutely.
Yes.
The network itself is something the UP Center has been developing, so you're still growing.
Right.
idea?
We started meeting as a small group back in the fall of 2015, and we really said the core agencies really said we need to push this forward. So fortunately, there was an opportunity through FACT, which is Family and Children's Trust, which is a trust fund managed by the Virginia Department of Social Services, and so we applied for the grant. As the UP Center, you had to have one primary agency, and we kind of were designated, and we received the grant. It's a 2-year grant, and it's a community impact grant. So we will be forming this network using the funding for 2 years. And after the funding, the grant is over, we will continue to move forward with the partner agencies, creating this network in the Hampton Roads community. We've kind of labeled it, we use the acronym HR-TICKN, because saying Hampton Roads Trauma-Informed Care Network is a lot. So that's kind of what we were saying, HR-TICKN. That's what we're doing.
HR-TICKN.
HR-TICKN.
Well, why not? You know, it's catchy and people will remember it because it is a mouthful, and perhaps if you hear it now, you'll know what we're talking about.
Right.
So you've got a network that is formed, and you're also looking for others to join this, because the idea is let's get everybody on the same, in the same way of thinking. So can you give us an example of some, whether by name organizations or types of organizations that are involved?
Right now we have about 16 primary partners that have made a commitment to move this network forward.
Okay.
Local departments of human services, certainly CHKD, child abuse program is a big part of our partnering. We have TCC, Portsmouth campus. We have Kids Priority One.
Okay.
We have Champions for Children Prevent Child Abuse. We have several nonprofits and several private for-profit mental health agencies. We have faith-based agencies involved. Wow. So we have quite a few.
Great.
And we are looking to grow it. We have some missing partners that we really feel like we need to pull in. That would be public safety and the educational system. Okay. Businesses and organizations that serve people in our community can also be a part of this network.
Okay, and there's a number up on the screen and a website too where you can go if your organization or practice is interested in joining this HR-TICKN, Hampton Roads Trauma-Informed Care Network. Please give them a call. You can speak with Kelly and she will fill you in on what this is all about. Certainly if you are in the practice of working with individuals that are dealing with trauma, you may be aware of this and know about it, but just know that there is this collective way that you can actually work with one another, and I think everybody benefits when you're not trying to find what you're looking for in numerous places and you can just go to one. Right. So do you meet on a regular basis?
We meet bi-monthly, so every other month the large network meets. In between the two months period, we have small work groups. Okay. The grant kind of affords us to provide technical assistance and training to agencies and organizations. We will be building a website, so there'll be a HR-TICKN website. We will be having community conversations regionally, pulling in the communities and asking them and giving them some information about trauma-informed care, and then we will culminate the 2 years in a trauma-informed care regional summit.
Okay, terrific. So you've got a big plan out there.
Absolutely.
to really make this happen, and they want organizations that have not gotten involved to get involved. So it doesn't hurt to pick up the phone or
Absolutely.
go online and get more information about this network and how it can benefit not only your practice or your organization, but make you a part of a bigger community, and one that is definitely growing nationwide, worldwide.
Absolutely.
So this way of thinking is new. It is a little different, but it involves individuals of all ages. Of course, with CHKD and the Child Abuse Center being involved, children are a very integral part of who it is that benefits from this kind of thinking.
Absolutely. In fact, I'm just going to throw out a statistic, but a study shows that 68% of adolescents had experienced one type of trauma before the age of 16. So, that's pretty significant. And another number is 90%. 90% of all people who are involved in the social welfare system have experienced some type of trauma. So we know that we need to be trauma informed. We need to teach everybody how to respond and educate people about what trauma is and how it's different for everybody. from the time that someone walks into your office and is greeted, to what your office waiting room looks like, to your rooms. Like it's an entire change of mindset.
Wow. So it's huge, and it's really getting underway right here in Hampton Roads. So give them a call, and thank you for sharing. I know, but it's just a small slice of what this is all about. But we wanted the community to know that this is something they're going to be hearing more about. And now maybe they can understand how that relates to them, because it's a very, very important part of all of our lives.
Yes, and thank you for having us.
Oh,
Yes,
absolutely.
thank you.
Thanks a million for taking the time to share great information. And we're going to be back in a moment with details of a new program that's going to help raise the standard of living for Norfolk Public Housing residents.